Hi, hello, welcome back. Let's discuss this interesting neuroradiology case today. 78-year-old male presented with left-handed weakness. While taking detailed history, we also found out he had repeated falls. On examination, we found that he has superior gaze palsy. So these were our MRI findings. Please write down your findings. Okay, these are the second set of images. What are the findings in these images? Okay, let me explain the findings. You would have definitely appreciated the diffusion restriction in the right centrum semilual. That was the cause for his left-handed weakness. You could also appreciate there is thinning of the midbrain compared to the pontine belly. And you can appreciate the ratio is very low. Carefully when you see, there is definite decrease of the midbrain to pons ratio. You can also see the infarct in the centrum semilual, and there was cavum septum verrugae, and the pons was indented by the ectatic basilar artery. There were also some multiple small, tiny. This was a verge, and you can see definite ectasia indenting on the pons. And you could see tiny lacunar infarcts in the bilateral corona radiata. And this angiogram showing the ectasia narrowing of the PCA, bilateral MCA, could be atherosclerotic narrowing. Again, in the sagittal is the most obvious finding where there was clear atrophy of the midbrain, just removing the drawings to clearly create a visual impression of the pathology. This is typical narrowing, which you are appreciating. So at this point, and there are also some spondylitic changes. At this point, what's your diagnosis? Okay. So this is acute infarct. Then there was widened interpeduncular cistern in the first slide, and there was loss of convexity of lateral margin of the midbrain. And you could see the loss of convexity of the tegmentum. And this is the thinning of the superior calculus. And there was clear loss of superior convexity of the midbrain with atrophy. And here the midbrain to pons ratio is one of the diagnostic point to diagnose a case of progressive supranuclear palsy. Here there is a clear atrophy and our midbrain to pons ratio is 0.15. What I would like to emphasize here is when your midbrain to pons ratio falls beyond 0.49, you should start suspecting PSP, and it is definitive or very clear cut when it is less than 0.25. So again, make sure that you see the flattening of the superior and inferior calculi of the midbrain to diagnose PSP confidently. So this is a typical hummingbird sign, which has been described. This is the artistic depiction of hummingbird sign. Again, the other findings also you should always document. Maybe his cause of Parkinsonism may be VAPD, means vascular onset Parkinsonism rather than PSP. So if there is overlap, but as a radiologist, you should give a cafeteria approach to the clinician. So he will pick up what is apt for the patient. So in our case, there was vascular cause of dementia. He had dementia and he had neurodegeneration. It could be a vascular cause because of atheromatous narrowing and all, and the repeated falls are most probably secondary to PSP. So this is one of the underdiagnosed condition. You should make sure as a young consultant or resident, you should always look at the midbrain to pons ratio to diagnose PSP. Sometimes it may be overdiagnosed if you don't have the exact, because normally also there will be slight thinning of the midbrain at the mammillary body level. But you should always measure in the appropriate location to diagnose PSP. Type of primary Parkinsonism or Parkinson plus syndrome. Supranuclear palsy affects the upper pathways, affects the substantia nigra, superior calculus, and medial longitudinal fasciculus. Supranuclear gaze palsy and severe postural ability are false. This is a clinical typical history they give. Like in the NPH, they give urinary incontinence and other findings. You can definitely see pontine tegmentum high signal, tectum of the midbrain high signal, inferior olivary nucleus high signal. And nuclear medicine has its definite role in diagnosing this condition. You can see loss of normal comma or crescent sign in the striatum. So classically, you should see there is the hummingbird sign or penguin sign, and you can definitely see the morning glory sign. You can see the Mickey Mouse sign. And when there is loss of midbrain to pons ratio less than 2.5, you can confidently diagnose this condition. This looks like a Mickey Mouse. This look like a ears of the Mickey Mouse. Thank you very much. Hope this video on PSP was useful for you.